I think Bill could have talked to us for the rest of the morning. He's got, not only has he got a great way to speak, but he's full of information and knowledge. And at lunch, you'll have a chance, some of you, to visit with him and the other speakers. I'm very pleased to introduce Dr. Bill Doherty, who many consider the foremost expert, therapist, theorist, scholar, practitioner in marriage and family counseling. And in the last bit of time, last decade or so, he's really turned his attention to community-based initiatives and public policy changes. He's a professor and the past director of the Marriage and Family Therapy Program at the University of Minnesota, one of the best in the country, and he now directs the Minnesota Couples on the Break Project and the Citizen Professional Center. Let's hear it for Bill Doherty. He's going to have us with a nice.
Good morning. It's always helpful to be the 8th speaker. So I'd like to thank the program committee when people's bladders are full. But I do want to take credit for the hot weather. We hit 102 in Minnesota last week, and I brought it down with me. But I hear it's 75 today, so it will get better for you. But I do it, so I'm going to tell you in 20 minutes everything I know. I'm going to bring you gifts, and I want something back for my state. Athletes. Enough said. So I want to begin by acknowledging how difficult and tricky it is to talk about marriage initiatives promoting healthy two-parent families in a world where there is a tremendous range of family forms that are not those. I remember when I first tried to find my voice on this issue, and the challenge of finding a voice is to talk about certain things we want to promote, certain kinds of ideals and values, without disparaging people who find themselves in different kinds of family situations. And so one of the challenges for Kansas is going to be to find your collective voice on this issue. And I remember it was the early 90s, and I was trying to, again, find a way to talk about this. And I was talking to a group of marriage and family therapy colleagues. And when it came to Q&A, a colleague of mine in the front row, a good colleague, a very seasoned marriage and family therapist, said, "Bill, are you telling me that my 19-year-old daughter should go back to that creep of a boy that got her pregnant and marry him?" And I said, "No, I actually wasn't thinking of that." What struck me was a mature colleague had a meltdown when I talked about the advantages of promoting married two-parent families. Because now, she and I talked, and she's actually with me on all this now, but it's really tough. I work, in the last few years, I've worked a lot with low-income unmarried fathers who are trying to re-engage with their children and have good relationships with the women that they had children with. And for many of them, it is not viable to go back to that original relationship they had with the child. It would be destructive for one or the other. And yet, they aspire to have a new union with a woman that they can spend their life with. And so it's compassion for the situations that we find ourselves in. And Rob, I'm so glad you talked about your own biography on this. I think it's really important. And to not give up on certain ideals. And it was Jesse Jackson at a talk, a national conference for marriage and family therapists who nailed it for me beautifully. He said, accepting and working with that which is real does not mean giving up on an ideal. Okay? So families come in so many forms, and if, as a service deliverer, when people walk in my door, I work with them as they are to maximize all the strengths they have. I don't say, well, why don't you find a husband? Right? I don't say that. I work with people who, as they are. On the other hand, so this is the frame I'd like to offer, and that is for future generations. How do we want to leave the state of marriage for our children and grandchildren? That's the frame I'd like to offer. Because most of us do not aspire to our children and grandchildren having multiple cohabiting relationships that break up in pain, maybe with a child or two along the way, in which the parents break up in despair, marry at some point, and then go through a creative divorce, okay, and figure out how to do co-parenting long distance, and then have other churning relationships with the children bouncing around. Very few of us aspire for that for our children and grandchildren. Now, if that happens, of course, we will work with them. And so one of the ways to frame this for me is to think about the future. And what I'd like to argue, and Rob said like he was referring to this, if we don't do something, that future is not so good with them. I mean, if you are, as I am, concerned about climate change and global warming, if we don't start to do some things soon, it's not going to be very good for our great-grandchildren. And so if we don't do something about marriage, the trajectory for non-marital births is at 40% nationally. It's in 90% in some of our low-income communities. And that's not slowing down. The divorce rate has slowed down. The non-marital birth rate has not slowed down. And it's not like these folks are living happily ever after without a marriage license. I would not be that concerned at that point, frankly. Okay? It's that they're breaking up. In fact, our children go through churning adult relationships over time. And it is so hard to be an active, involved father when you go on to other relationships and your mate goes on to other relationships, and the complications of all that. It is very difficult. We have to aspire to it. We have to hold ourselves responsible as fathers, but it's very hard. If we don't change something drastically, the divorce rate is likely to stay, you can't prognosticate with complete accuracy, at historically high levels. And what we're seeing is a very unfortunate divide breaking out between college-educated couples and people without a college education. And this isn't widely known even in our field yet, but the research in the last 10 or 15 years is showing that the divorce rate has gone down for college-educated couples, and it has not gone down, and maybe even going up. Certainly it's not been going down from the historically high rates for working-class and low-income couples, who, by the way, are the group who are having the children outside of marriage. So they're having a lot more children outside of marriage, and when lower educated couples get married, they are divorcing in historically high numbers. Marriage is becoming a stable, healthy, lifelong marriage is becoming the privilege of the middle class. And that, I think, will be a tragedy for our children. Because it'll be the luck of where you got married, what family you were born in. Children do not get a choice in where they're born. Okay? And increasingly, across racial and ethnic lines, children born to high school educated parents and below are experiencing churning childhoods. And the research on divorce, by the way, and children in single parent families is showing that that further transitions. We've known that conflict between the parents is bad for kids. We've known that father disengagement is bad. But now we're seeing that multiple transitions, the more moves children go through, the more new adults coming in and out of their households, the more those relational changes. The more transitions children go through, the worse they do. And adult lives now, our romantic lives, are lives of churning change, particularly among people who do not have a college education. So we need to do something about this. And what I'd like to suggest is that it's not going to be enough to only stay with the approaches that we have done in the last 40 years. That Bill Coffin did a great job with a good light touch, because I was worried it was going to be really boring. No, do not bore them. And I think he accomplished not boring. Anyway, But we have to go beyond those because we're not going to make the powerful interventions if we only take a teach or treat approach. We have to do both, and I'm an educator and a therapist, so believe me, I think we need to keep doing this, but they're not going to be enough. Our problem with the failure to form and sustain healthy marriage is not like people don't know how to drive a vehicle, and we have to teach them how to have better driver's education. It's not only that. There are powerful cultural forces, a kind of a me-first individualism. We've gotten to the point where divorce, if you don't feel love anymore and it's not working out, you have the right to leave, and people will support you in leaving. We have in many communities now, particularly low-income communities, a despair about the possibility of finding a mate who will be faithful to you, who will not hurt you, who will stay with you as you raise your children together. A despair, an ideal, a wish, and a despair. And we know that children of divorce have 50% higher likelihood of getting divorced themselves, and they are more likely to marry a child of divorce. And if you marry a child divorce, your likelihood of divorce goes up 200%. So we have a generation who are scared about marriage based on what a poor job us baby boomers have done. So there are powerful cultural forces that are not going to lend themselves to only teaching classes or doing therapy. And one of the disadvantages, by the way, of putting all of our eggs in the basket of teaching classes and doing therapy, and again, I do both, is that only the volunteers come forward on those. Okay? And a lot of times the people who need it least are the ones who sign up. This is always the challenge with prevention. The people who need it least seem to be the ones that sign up. So I have two newer ideas to leave with you today. One is to begin to experiment with universal prevention. Bill Coffin used this, and we used to call it primary prevention, that's way upstream, but population-based. We have not done population-based interventions. In the healthcare, vaccinations are population-based interventions. So children getting certain shots when they're born that keep them from developing certain dreaded diseases. You know, they get vitamin K when they're born and they don't get certain diseases. Putting fluoride in the water was a universal prevention of dental disease. And I think we're at the point now, and I have a model bill that I hope someday that will get introduced somewhere. But we could consider, and this would involve government and public policy, based on the known risks for children whose parents are forming marriages that create stepfamilies. So are you with me on that? A remarriage, or you haven't been married, but you are getting married, and one of you brings children into the marriage. So a marriage that forms a stepfamily, which is a huge number now. Because a lot of the unmarried parents are getting married at some point, but they're marrying the father or the mother of, not their child, okay? They're forming stepfamilies. And 40% or more of all weddings are remarriages for one or both people. So this is a major family form. There is a substantial body of research showing the risks to children in stepfamilies. They do no better in general than in single-parent families. We know those risks, the post-divorce families. And in fact, for child abuse, the risks go higher in a stepfamily. So I think we have a case now for the benefit of children to have a universal requirement for marriage and parent education before you can get married. If you're bringing a child, if you're forming a stepfamily. And this could be done now without preventing people from getting married in a timely way because of the advent of effective online educational courses. We could not have had any requirement. This has been like the holy grail in the marriage field, Bill Coughlin, right? Is to have premarital required education. Like we say, before you have a driver's license, you have to show you know something about vehicles, right? But one of the reasons we couldn't do it is we couldn't show a direct benefit to children, and the government has a challenge about getting involved without the needs of children. And secondly, if you're in rural Kansas, there might only be a course every 6 months, and you don't want to wait that long. But now there are effective, at least in the parent education area, effective, and I think we can do it in the marriage area, effective courses. This could be a universal preventive work. So that's an example of a population-based intervention where you have to do it. Okay. On the other end, this targeted or tertiary prevention that Bill Coughlin talked about is before it's too late. Our work in Minnesota in the Couples in the Brink project, we now have evidence, and they're replicating this in Georgia, that a lot more people who have filed for divorce are ambivalent about whether they should get divorced than anybody had realized. That 30% of the divorcing parents, now that is individual parents, in Minnesota say that they would be open to reconciliation services. And when you match them as a couple, and these are people who are nearly at the divorce decree, at the couple level, 10%, well into this process, say they would seriously, both of them, consider a reconciliation service. And the earlier you get them, so we now have data from divorce lawyers' clients, and half of the people going in to see a divorce lawyer are not sure divorce is the right answer for the marriage. Okay? So what we have done, we have a bill that we submitted in our legislature last year. We'll come back again this next year with it to mandate parent education prior to divorce, pre-filing. So before people could file for divorce, they have to get good parent education with a 12-minute reconciliation message. And then resources for people. So without going into any more details on those are examples of population-based, not volunteer, but population-based interventions that I think we need to be thinking about for the benefit of our children. And then the last thing I want to talk about is a missing ingredient in this whole area of promoting healthy marriages and two-parent families. Where are the couples? Where are the couples who embrace this, who promote it? Where are the people who would come to meetings like this, not as a professional, not as a graduate student, because they are married people who believe in marriage? We have a professionalized marriage movement, if you will, without a citizen involvement component. And my belief is that we don't get powerful social change, and that's what we're talking about here. And that's what Kansas is trying to do something about. Not just tinker with, but try to start powerful social change. You don't get that without people in the grassroots being involved. Where would we be with alcoholism without Alcoholics Anonymous, which, by the way, was not formed by professionals? Where would we be with drunk driving without Mothers Against Drunk Driving? Okay, it wasn't the treatment facilities that got us the social and legal changes about drunk driving, which is way down in this country. When I had my wife and I had our first child in 1973, and we did prepared childbirth. I was involved. That was like the beginning of that wave back in New England, and we were seen as a little weird. But, you know, Lamaze League and others were coming along. Now, not because of obstetricians, but because of the Lamaze parents, because of parents, now, if you're a father who doesn't want to be in the delivery room, they say you're a wimp. When I was doing it, it was like, what are you? Because that's doctor's territory. The father was supposed to smoke a cigar, pass out cigars. And with the social change now, you are expected to be involved. And if you're a mother, you're expected to take classes. Not everybody does, but there's been a powerful cultural change. Look at breastfeeding in this country. The La Leche League, There were 5 mothers, middle-class suburban Chicago mothers in the 1950s who wanted to breastfeed their children. They were friends of each other, they were having babies at the same time, and there had been a generational cutoff in breastfeeding because in the early 20th century we decided that scientific parenting and mothering was great, and that meant formula. And so their mothers couldn't teach them how to breastfeed, and they formed their group, and they found resources, they taught each other how to breastfeed, and that's an international movement. That then you had professionals endorse and embrace, and there's lots of research for it. So what I think we need, in addition to what we've been doing, are population-based interventions, and we need to engage citizen married couples. And I have 2 brief ideas, and then I'll finish up. One of them would be groups of young married couples reclaiming marriage for their generation. My daughter is in her 30s, and she's gone to conferences like Smart Marriages Conference. She loves us old guys, and she says you're old guys. That the stories you tell are stories of another generation. Okay? They're based on more traditional gender roles. They're based on a generation where men and women didn't have friendships with each other, as well as romantic relationships, where both people worked in the workforce, a different world. And so why not pull together groups of young marrieds, the children of divorced generation, to reboot, to reclaim, to reinvent marriage for their generation? To reinvent marriage for their generation with our love and support and help. That would be the young citizen marriage. And then the last thing, and this one, and by the way, this is a concrete proposal that I'm offering, and a former student of mine, Jared Anderson at Kansas State, knows how to do this. This is the community organizing and families work that I've been doing with my colleagues for 15 years, but we've not pulled it off with marriage yet. We've had parent groups. And so this is a concrete proposal. I'm willing to coach Jared Anderson, who can coach other people, on how to try to create a social movement of young marrieds to reinvent marriage for Kansas now. The other one, so that's real, that could happen. Okay. The other one, 10 days ago, I got an email from a man who, he and his wife are 2 of the people I admire most in my state, who have created what they call extended family networks in the African American community in the Twin Cities, where 25 families covenant to raise their children together. It's an extended family network. And they have replicated this and created a number of these networks with a fascinating model. 5 core families. In fact, it's Eric and Carletta Yancey. And it started about 15 years ago with Eric and 4 other African-American professional men forming a support group to try to help each other advance professionally. And they began to talk about their marriages and their kids and various crises. And it wasn't just a professional support. And then they said, why don't we get our wives together? And they formed an intentional bond to try to keep their marriages together and raise their children together. And they formed this model where each of the 5 hub families recruits 4 other families in the spokes of the wheel. And then they form an intentional community of 25 families. And they have rituals together, they get together, they know each other's kids, they go to graduations, they go to other important things. And when there's a crisis with a child, there's a crisis with a marriage, they intervene. They call each other uncle and auntie. They have big community picnics that I've been to, and they have created a model, which I've admired greatly. And so Eric Yancey emailed me 2 weeks ago and said he'd like to try to do this around marriage in the African American community. And would I talk with them about some ideas? Because I had helped them figure out how to replicate their first group with the second one. And so he and I and Carletta and I are going to meet. But that is a very interesting on-the-ground model that has worked for a particular community. So those are just examples. But my point is that I think we have to find ways to engage our fellow citizens in this work. If it stays professional, if it stays professional, then people are going to be consumers or clients of our best research services, which we have to do. So please understand, I believe in that. I do it. I will continue to do it. But we need to have people who, in the future, if there are more of these, that somebody is up here as a citizen married couple, okay? A young couple, middle-aged couple. And we have to see this as a broader social movement. So what I want to say in conclusion is that, on a personal note, the day that I heard that my first grandchild was born, I was driving a car, and I realized that children born now, with some luck and decent medical care, have a good chance to live into the 22nd century. And what I realized is that I saw my job as a parent to prepare my children for the world. But my job as a grandparent is to prepare the world for my grandchildren. And that's what we're here about. Thank you.